Getting dental work abroad can feel risky, but not with Chiang Mai's best. They've been trusted since 1981.
43 years. It's a pretty long time.
If their accreditations and awards aren't enough for you to decide, don't worry. There are plenty more perks.
Where do most of your patients come from? Like from which regions or countries?
From our data, we have like mainly around 50% of the patient is local here in like Thai people, but the rest will be from abroad and also the expat patients. So mainly 20% of the patients will be from the state and around 15% will be from the Australia and New Zealand. Not we conclude New Zealand and Australia together because not much from New Zealand because of the size of the population also. The rest will be from like Hong Kong, China, and also from German, Swiss, and French.
Now, what makes your clinic stand out from all the clinics in Chiang Mai and in Thailand?
We have the technologies that we are using in the dentistry. We do a lot of investment in the instrument and all the medical supply, like the Straumann implant or the Straumann group material. Also like the scanner, intraoral scanner from 3Shape, that like the outstanding scanner in the world. And also like the dental CT scan, everything is like the high end. And also we can do the procedure that many dental clinics cannot do. It's like we have the dental microscope, so we can do the microsurgery. We can do like the endodontic treatment with the microscope. And we can have the sedation, offer the sedation for the patients, like the metatarsi sedation or the oral sedation that not available or in every dental clinics in Thailand. So we looking for what could be the benefit for the patients, and we try to support our dentists with that instrument and all the process that they can just really focusing on take care of the patients.
But when was the clinic established again?
So the clinic was established in 1983. 43 years. 43 years.
Congratulations for being a well-known established dental.
It's a pretty long time.
Okay.
As I said, I was born in dental clinic. We also have the 3D printing device on our own, so we can do our works more easier. And also like we have the diode laser. We also have the electro surgery. So we have the different types, the new technology for the dental practice. That's why I'm starting to focusing on the dental laser, because I think in the next few years or the next decades, dental laser could be like the thing that the patients is looking for.
You're thinking ahead already before it even happens. So
we need to prepare.
That's true. That's true. And how much can really patients save on dental procedures compared to US or Australia?
If we comparing to the dentist in Australia, the cost that is like the difference of the cost will be like 2 or 3 times lower. Comparing depends on the procedure.
What are the most like popular procedures you're doing now at the clinic?
I would say dental implants is the thing that, because the patient can do the teeth fillings, extraction, the cleaning everywhere. It's like they can do it at home, right? So once they want to fly over the country to get it done here. So majority will be like dental implants or crowns or the full mouth rehabs, like to make rehabilitation for the full mouth to regain the function. And also sometimes like they're seeking for the aesthetic outcome. like the Hollywood smile, or sometimes just not like the Hollywood smile, but have the more nicer and charming smiles.
What sterilization procedures you follow right now at the clinic?
I think that is a good question because right now I think all the dentists around the world, we know that we need to use the orthocare for this steam sterilization. But it's not only the thing that we only use the steam sterilization, but we also have the monitoring to make sure that our machine is working as we want. So we have the on-site biological test with like the spot test to make sure that our machine can kill the bacteria, the spore of the bacteria that really hard to kill. So we want to make sure that our instrument is clean. And not only the instrument that we're using for the patient that has been tested, the water in dentistry is very important because everywhere is water. Like when you get the teeth cleaning, there is water. When you do the teeth, there is water. So our water is water from reverse osmosis water. And we use the ozone to keep that water sterilized, kill the bacteria inside the water line.
Do you have an in-house lab, or do you also work with trusted local labs near?
Okay, we have some part of the procedure, some part of the application. We use our own lab, but some part of the procedure like the crowns or the bridge veneers, we use our trust very close dental lab in Chiang Mai. It's like we have been working with them almost 30 years already. And that's why we can do the things like in one day. You can see like the many dental clinic abroad overseas, they claim they have the advertise that they can do the crown in one day with their own lab. It's like the same. We can do the crown in one day with our partner labs. And this partner labs is really like the biggest dental lab in Thailand. And they have like the FDA approved, they have like the ISO certified for their jobs. So the material, the workflow that they perform, the lab for us, the prosthesis for us is very trustable.
Apart from you, Doc, who speaks good English, do your staff or other dentists also speak English, or do you provide translators if needed?
Our staff are like the customer service. Some of them used to work in Australia, some of them used to work in the States. And also our faculties, like the dentists, my colleagues, like more than half of them graduated from United States. So they can speak English really well and also can communicate with the patient really well in English. However, in another language like China, German, or French, we could use the electronic translator in some cases, but in some cases from Chinese patients, we can arrange the on-site translator for them if we need it.
Is it also accessible for patients with disabilities, or do you have people who can assist?
Yes, we also have the geriatric dentistry, so we can service for the patient with wheelchairs, patient with Parkinson's, or patient with the mental retard. So we can offer the service to them. So they can have like the wheelchairs from their cars when they arrive into the treatment room, and also the toilet. These are the wheelchair accessible.
Curious to know why it's so affordable? Watch this video next.
Get a great smile with Dentification. Visit a hand-picked dental clinic today.